Hello, and thank you for the opportunity to speak at your meeting today. I wish I could have been here in person, but while we've been meeting weekly with all school boards since March, the last few weeks have been increasingly busy for school boards and staff, and I want to thank everyone for your ongoing collaboration, your commitment to provide education to Ottawa's youth. A lot of work has gone into implementing the provincial guidelines that support infection prevention and control in schools. And there are multiple protective layers involved in keeping COVID-19 in schools, that transmission as low as possible. Most importantly, keeping cases low in the community will help prevent COVID-19 from entering schools in the first place. So I'd like to take this opportunity to respond to some of the questions that have been shared with me regarding the safe opening of schools. And a written response has also been provided to all of your questions. So face masks, there have been a number of questions around this topic. Does the wearing of face masks add significantly to the safety of students and staff? So although there's a lack of evidence about the effectiveness of masks in younger children specifically, mask use in the general population has demonstrated its effectiveness at reducing COVID-19 transmission. Recently, I've been asked, what about making masks mandatory for younger children, kindergarten to grade 3? Ottawa Public Health cannot quantify the benefit that mandatory masks in younger children would provide in terms of safety of returning to school, but we expect that masking would provide some additional benefit. We recommend that younger children should not be discouraged from wearing masks if they're well tolerated and if they are able to wear them properly. In terms of best practices that would minimize the risk associated with improper mask handling, especially for younger students, it's important to make sure that there's proper size and fit that allows children to become accustomed to wearing a mask at home before wearing one in public. That could increase tolerance of mask use. If a young child tolerates a mask for only a brief period of time, schools and parents should consider prioritizing masks for situations where physical distancing may be more difficult to maintain, like at pickup and drop-off. I also get questions about if face shields are an appropriate alternative to masks for students who can't tolerate a mask. A face shield is not a substitute for wearing a face mask, as it does not filter respiratory droplets, but it may provide some protection for the wearer against droplets expelled from another person. However, these droplets may still be inhaled around the shield. It could be considered a better alternative to no mask, but it's not a replacement for a mask. In terms of whether Ottawa Public Health has specifically endorsed the school board's safety plans for students and staff, please note, Ottawa Public Health's role is to act as a resource, providing support to school boards in implementing the provincial guidelines for infection prevention and control, and to answer questions of a public health nature. Ottawa Public Health does not approve school board plans. It's outside of Ottawa Public Health's purview to provide advice on school board priorities, and we cannot comment on the limitations to operations that might exist. But each school environment and population is different. Therefore, we may need to have variances in how the safety protocols and procedures are enacted in every school. So in terms of class size, there is no one-size-fits-all approach with class sizes and physical distancing, as each school, even each classroom, can have unique configurations and circumstances. So the greater the number of children in the classroom, the greater the risk of introduction of COVID-19 into that cohort of students. Efforts should be made to reduce the number of students in classrooms as much as possible. And while 2 meters is the preferred distance and has been communicated publicly by Ottawa Public Health, the school environment is considered a more controlled environment, thus shorter distances between 1 meter and 2 meter may be considered because of the added protections such as masks, personal protective equipment, enhanced cleaning, and the regular screening to keep people who are sick at home. I know that several schools and school boards rely on occasional teachers or supply teachers. Schools should make efforts to limit the movement of staff between and within schools as much as possible, recognizing that movement of staff in this manner increases the number of contacts that staff have and the possibility of introducing COVID-19 into a new setting or group of individuals. It's very important that staff who must serve between more than one school or between classes maintain a log of the school and the classes they've attended in order to facilitate contact tracing. And it's important for all staff to receive adequate training on school procedures and protocols, such as proper PPE use, to follow all the precautions needed to increase protection, the use of masks, physical distancing, and vigilance with hand hygiene. It's extremely important for all school employees to be screened for COVID-19-like symptoms every day prior to beginning their workday. And staff must take care to maintain physical distancing with other adults in the school at all times, including during lunch and in break rooms. As your local public health unit, we are working in the community to promote important COVID-wise prevention strategies. These strategies will assist in keeping community transmission as low as possible, and they're also very important within a school setting. So the WISE in COVID-wise means W for wearing a mask or face covering when you're in an indoor public space, and even outdoors if you can't maintain physical distancing. I is for isolate yourself from others when you're sick and get tested promptly if you have COVID-like symptoms. In a school setting, this means that parents will need to complete a daily screening for their child prior to school entry every day. Also, all school employees need to be screened daily prior to entering the building. So we've created an online screening tool to assist in decision-making. It's a series of short questions to help parents and guardians decide whether their child should be attending school. The S for stay ideally 2 meters apart from those outside your household. And I do understand the challenge in doing this in a school setting, so 1 meter of physical distancing is maybe perhaps more realistic. E is exercise proper hand hygiene. Wash your hands regularly or use the hand sanitizer before touching your face, putting on or taking off your mask, and before and after meals. So each school is being assigned a public health nurse who will stay connected and support implementation of these principles with the principal and staff and students. The nurse is going to visit the schools regularly, be able to answer questions, and highlight challenges to be addressed. We will continue to engage in open dialogue with boards, schools, children, youth, parents to address concerns and provide up-to-date resources and information. We have to keep learning together throughout this challenging and ever-changing situation. We'll regularly update our school resource website, webpage, with more information as it becomes available from the province. So I want to continue to thank you for this collaboration and the ongoing commitment to children and youth in our community. I am sorry that I couldn't be with you in person, but I appreciate this work you're undertaking and considering tonight.